Tom's story, a new beginning for care and support in Dundee. Dundee Health and Social Care are about to embark on a journey of integration to change the way we provide care and support for our citizens and provide a unified approach to delivering services. The shared vision is to achieve the best outcomes for families and communities by putting people very much at the heart of everything we do. The population of Dundee is ageing, with many of our citizens still living in poverty and suffering from inequalities. The poverty Dundee experiences is not the same across the city. We have 54 diverse neighbourhoods throughout the city, and each community has different needs, different levels of poverty and different health inequalities. Over the next few years, these factors will create more and more pressure on our existing health and social care services, resulting in a potential failure to provide good quality care to those who most need it. Providing health and social care services to the citizens of Dundee is complex. It involves inquiries and referrals, visits and assessments, care planning, service delivery and reviews. The NHS and social work services for adults and older people are fundamentally still the same as they were when they were first created. They were designed to treat single episodes of illness, one at a time, or provide care and support for each time someone needed it. With the increasing demands, we now need to think differently about how we use our funding to provide better adult and older people care and support services. The main purpose of integrating health and social care services in Dundee will be to improve the well-being of people who use our services. In particular, for those managing long-term multiple conditions who need to use both health and social care service at the same time. GPs, hospitals, health workers, social workers, social care staff and others in Dundee will work as one team to provide care and support around a person's needs. Putting the individual at the centre will mean information can be better shared. A much more coordinated approach to providing care will emerge, and it will offer people choice in the support they receive, reducing hospital and care home admissions and allow a more active, independent lifestyle for our citizens. To help illustrate our new approach, here is Tom's story. Tom is in his early 70s and lives alone in his two-bedroom semi-detached house in Charleston. He has not coped well since his wife died 2 years ago. Tom's daughter, who lives in Broughty Ferry, helps to care for Tom when she can, but with 3 children and working full-time, she struggles to juggle everything. His grandchildren come to visit, but he struggles to keep up with them and be the type of granddad that he would really like to be. Tom spent his life in the army until he was discharged after suffering a brain injury as a result of an accident. The injury has affected both his mobility and memory. Tom is an ex-smoker and has a number of long-term health conditions, including emphysema and type 2 diabetes. Tom frequently visits his GP, who is based in the Fintry area of the city, which is where Tom grew up. Tom needs to get 2 buses to reach his GP practice and finds this increasingly difficult on his own and very physically demanding. As a result, when Tom has a crisis and can't get to his GP, he calls an ambulance. Each time Tom is admitted to hospital, he has to repeatedly explain all of his health conditions, and sometimes he forgets some important details. Tom finds this increasingly frustrating. Each time before being discharged from hospital, Tom has to be assessed for the supports he will need at home, meaning Tom's discharge from hospital is often delayed. Once home, there is a delay in his information from the hospital being received by the GP and social work services. This means Tom doesn't get access to the support he needs when he needs it most. The number of times that Tom is admitted to hospital has increased over time. This has resulted in Tom losing his confidence about returning home, and the hospital staff have recommended that he considers going into residential care. If we looked at Tom's story through the eyes of integration, it would be very different. Let's imagine that one of the professionals involved with Tom's care and support, such as his community nurse Angie, was given responsibility for being a single point of contact for Tom and for coordinating his supports. Angie meets with Tom, she listens to him, and he feels included. Angie, Tom and his social worker design an anticipatory care plan. It becomes clear that Tom wants to manage his care at home and stay in his own home for as long as possible. Tom and Angie work together to manage his diabetes and emphysema. Tom's care plan is made available to all professionals involved in Tom's care. Because all the professionals know what's in Tom's care plan, he doesn't need to repeat his story to everyone over and over again. The team caring for Tom can now make decisions and act accordingly without having to wait for assessments to be done each time. This means that Tom has his supports changed as his needs change. He goes to hospital much less often, and when he does go, he gets home more quickly after a review of his care plan. In Tom's story, health and social care staff work together to provide care and support through their own decision-making and joint budget. Tom's health needs inevitably do change. After a discussion with Tom and his family, it is decided to have a stair lift installed and provide him with an oxygen cylinder to help with his breathing. Tom is supported to access resources through self-directed support to help him around the house. This has allowed Tom to make a choice about the support he needs, especially with his beloved garden. Angie and Tom's social worker also put Tom in touch with a voluntary sector befriending service, who support Tom to get to the lunch club at the local community centre and to get along to the community allotments to tend to his vegetable patch. Before, services involved would have had to reassess Tom separately each time for these supports. This would have meant fragmented care and support, which could be very confusing and frustrating for Tom. Tom is able to stay at home, enjoy his time with his grandchildren and his gardening, and not be admitted into a care home. His daughter is able to support Tom better and manage her own life commitments and feels less stressed. Tom is also more active within his own community, attending events at the community centre and making new friends. Tom feels happier and healthier and certainly more independent. Simply put, services have worked together to develop care and support centred on the needs of Tom as a person and not round his health conditions. The joining up of resources allow the information about Tom to be more easily shared, helping decision-making about his care. Most importantly, Tom has been involved throughout this process. This change means that we see fragmented care with inflexible choices and hard-to-access services disappearing, making way for better coordinated, flexible care and support being provided to people based on their own choices. By helping people to be more involved in the communities around them and adapting services to their needs, we can change our citizens' experiences and outcomes in life for the better. This is the journey Dundee Health and Social Care Integration is about to embark on, and it's now time for us to change the way we provide care and supports to our citizens. So, like Tom, they can be active and more independent for longer.